It's 5, 4, 3, 2, 1. Good afternoon. Today is Tuesday, July the 2nd. This is the Public Health and Safety Committee. We do not have a quorum, so we are going to skip ahead and we are going to hear our presenter or presenters this afternoon. Dr. Ann Melville-Chester from the Metro Health Department, Tom Sharp from the Health Department. And the reason why we're having this presentation, this is specifically about around the opioid settlement process. Metro Davidson County had some additional funding that we received from the state, and also directly to our Davidson County. And this whole time, probably since the start of my term, I referenced this periodically and said, oh, we're going to talk more about that whenever we're approving legislation. And it turns out we're not approving legislation because we have went through the procurement process on this funding. So that's so Dr. Ann Melville-Chester was gracious enough to come today. So I will turn this over to her, and you're recognized.
Thank you so much, Councilwoman Evans, and to the rest of the council. I appreciate the opportunity to present to you this afternoon. As Councilwoman Evans says, I'm Dr. Ann Melville-Chester, and I just want to walk through the presentation this afternoon. I'll do a little historical context for you, walk through our opioid process, then talk a little bit about our contracting, then about Metro's role in the process, and then take any questions that you might have. So let's go through. So right in front of you, painting the picture for the historical context, you will see from 2018 up to 2023 what our numbers look like. We started out with 346 suspected fatal drug overdose per year in Davidson County, and now we're up to 745 overdoses. What that means is that we've had approximately 2 deaths per day in 2023. And as of 2024, we have about 1.5 deaths per year. I will say that is one too many when we talk about overdose and we talk about this crisis. So here's some more on our historical context. In 2022, Nashville, Davidson County received $23 million in settlement funds that will be dispersed over the next 18 years. That's about $1.3 million per year, approximately 9% of the $242 million that came into Tennessee. The funds were directly given to MPHD to prepare and implement an opioid process. We held a series of stakeholder meetings to identify system gaps and determine the best use of the funds. Moving forward, we developed what's called the opioid care process. You'll see that as I continue to make this presentation. We vetted that with stakeholders and then continued the process. So we were very methodical about how we went about utilization of the funds and engaging the community in the process. In 2022, I just want to go back and put a little bit more context on this. We had 78% of our overdose deaths were related to fentanyl. That's comparable across genders, and that's up 53% since 2018. Fentanyl impact is comparable across races, but cocaine is a more significant cause of death among Blacks. Okay, suspected fatal drug overdose in Davidson County between 2018 and 2023 increased from 348 to 745. That's a 115% increase over 5 years. While we're seeing some decline, we do not want to get comfortable. One overdose, like I said earlier, is one too many. Residents between the age of 45 and 54 consistently are at the highest risk for overdose death during this period between 2018 and 2022. And our next high-risk group is our 35 through 44-year-olds. Emergent substances such as xylazine, I'm sure you've heard a bit about xylazine, or they call it tranq, or you might hear somebody refer to it as the drugs that's used by veterinarians. It's a fentanyl analog, have been identified and documented as one of the things we need to be concerned about as residents and as leaders in Davidson County. Our current data highlights that we have an escalating crisis of drug overdose death. This is primarily driven by fentanyl and the increase of stimulant co-use by over 60%. That's just giving you a little historical context for some grounding as we talk about the development of our overdose care process. So here's our opioid care process. If you look to my left, probably your right, we're looking at harm reduction. And harm reduction is around education and the use of Narcan. We walk through the process. You have in yellow, it's overdose. And the care process will take it whether you go to a walk-in to a clinic or whether the emergency room. That's one process. You walk into the ER, you go to detox, there's inpatient, respite recovery or medication-assisted treatment, or you go to an acute long-term treatment facility, and on the other end, you go to intensive outpatient care, which would be greater than or less than a year for MAT, and then there's counseling services. The other side, you go to a long-term treatment, which you have some social services wrap around. So that's one area. We go back to the yellow where it says OD, and maybe you enter the process through call of EMS. So EMS came in, they administer Narcan, you go to the ER. When you're in the ER, some peer navigators would be there to help you navigate the process. You move from that peer navigator to referral to a detox. And then once again, you go down the inpatient or outpatient or acute long care. It could be that EMS came in, but you didn't need to go to the ER. So you go down, you get some information, you get some follow-up, you get some education, and you get released. We don't want that to be the end, because if it is the end, it means that you could start the process all over again. So the connection is maybe you need to go to a detox. So you take the arrow up and you go to detox, and it starts you through inpatient, respite care, acute, or intensive care, and you are in that part of the process. One of the things that we thought about as we were going through this process is all of this intervention is great and prevention is great, but we really need to go upstream if we're going to impact this process. So we need to look at adverse childhood experiences. We need to look at root cause. We need to look at what was happening to this individual prior to getting involved with a substance, with an opioid. And so Metro Public Health, we want to dive deeper in those root cause and go upstream in terms of our prevention and intervention efforts. I want you to hold space for that, and we'll come back to that later in the presentation. So what have we done since we've received the money? So gave you the historical context, let you know about our opioid care process, and what have we done? So we held a pre-bid session. Once we came up with this process, we put a RFP out, work with procurement on it. We had a pre-bid session in January, public comment closed in January, RFP closed on February 13th. 2 vendors were selected, Mental Health Co-op and Samaritan Recovery House. And then as of yesterday, the contract is in place for our implementation to begin in the opioid care process. So what's Samaritan's role in this opioid care process? Same diagram we showed you earlier. In red is Samaritan's role in the opioid care process. So the individual have an overdose. They might, EMS once again could get called. There'll be some peer navigators on hand to help that person navigate the system. They will move to respite care, move to intensive care, move into a transitional housing situation, and then the goal is to move that person into permanent housing. So we're looking at our unhoused population and making sure we're moving them into permanent housing if they're unhoused, which is really important. It could be that they come through the ER, like I said, and they need more intense services. Samaritan's role is going to be assisting us with our medication-assisted treatment and making sure that housing is a great focus of what they're doing. As a part of this project, Samaritan will have 32 beds available to help individuals that need to go inpatient for medicated assisted treatment. Mental Health Co-op, their project, and there's a project summary, is a mobile response program, which is exciting. It's the idea there is to increase access to treatment, medication, transportation, peer recovery specialists, and resources for individuals that are suffering from a substance use or abuse disorder, and focus on increasing access to community services to decrease the utilization of the emergency department. And so, as you can see, when you look at the partnership, they will complement each other. While one will have mobile access to decrease ER use, and that's important as a part of the process. Next slide. No, go back one slide, Tom. CMRR, no, yeah, you've gone too fast. Here we go, right here. We're on the same page. Thank you. So their role in the opioid process is referrals through walk-in, through Metro Police, through fire, through EMS, through our community partners. They'll respond mobily to the location where that overdose has occurred, and then do assessment by the clinician right there, engage the peer recovery specialists in the process, and determine the treatment needs of the individual, address the substance use disorder, and then provide treatment, whether it's naloxone or any other medication-assisted treatment that's needed, and refer for inpatient treatment and detox. So if the person needs inpatient, the partnership between Samaritan and Metro is that they will refer for inpatient to Samaritan if they're not able to fulfill that need. And then the connection to additional, as you see there, additional services through behavioral health, primary care, intensive outpatient social services, and transportation. So this partnership is really going to expand our capacity to provide services and treatment to Nashville, Davidson County residents that's impacted by substance use and abuse. So we've talked about Samaritan's role, we've talked about mental health core role, and then what is Metro Public Health's role? Our role would be in bed management and care coordination. We're going upstream to look at prevention, wellness, and harm reduction. How are we going to do that? Increase outreach and education, case management service, and clinical treatment and care. Our focus areas, the unhoused, African Americans, Spanish-speaking community, the Arabic-speaking and Egyptian-speaking community, or youth-serving population, and our young adult community. Our task is at the end of 3 years to develop an opioid care process system that's data-driven and evidence-based to ensure that residents of Nashville, Davidson County are able to maintain their health and wellness and to become healthy and engage in recovery and treatment when that's needed. This is our role in purple. This is Metro role, harm reduction, upstream intervention, care coordination, we're in purple, and counseling additional services in the community. That's our role in this process. And at the bottom, data tracking, data collection, and data analysis, where this pilot project is for 12 to 15 months, and we're going to track the data, track the uses, track the impact to ensure that we are looking at how the funding is being allocated in the community and how we are ensuring that Nashville residents and Davidson County residents are being taken care of around this opioid crisis. That concludes my presentation for this afternoon. And
Thank you.
Councilwoman Evans?
Yes, thank you, Dr. Ann. So we're going to take questions, any questions that the team needs to socialize, they'll come back. We'll document those and get those submitted to Margaret and have that information shared back with the committee. So I will recognize anybody with a question. Looks like Councilmember Huffman, you are recognized.
Thank you for the presentation. That was extremely helpful, a lot of good info. My question is around our unhoused population and how this epidemic is facing them. Could you comment on just how this crisis has excelled with that population over the last 12 months?
Could you repeat your question? I'm not sure I was very clear.
So our unhoused population, our homeless population, could you comment on how the opioid crisis has been affecting them and how that has excelled over the last 12 months?
Well, I think what we know from the data and what we know from intervention and treatment is that our unhoused population is at greatest risk for opioid use and involvement in this opioid crisis. And so what happens is that if the unhoused go to the emergency department and they get care and they get treatment and they're just released back into the community where there's no transitional housing, there's no respite housing, there's no stabilization of their housing, then you're going to have a repeat customer. Because one of the things we think about is that's a crisis. If you have nowhere to live, sometimes getting involved with a substance is about coping, is about trying to deal with life circumstances. And part of this program and part of what we want to do is intervene and impact those life circumstances that's having some negative outcome. And I think that's where the partnership with Samaritan come in. Yes, 32 beds are not enough. I will say that to this council. We're going to come back with an ask after this project is over because 32 beds are not enough. We need more beds to be able to provide treatment and to be able to move our unhoused population to respite housing, transitional housing, and then permanent housing.
Great, thank you. Has the health department, and this is my last question, Chair, has the health department at all coordinated with OHS or any other service providers such as the Salvation Army who provide temporary housing in regards to ensuring that folks that do get housed are not relapsing or not using anything like that?
So we're at the beginning of this process, and what we're doing now, as I said earlier, part of our role is to make sure that we have a robust opioid care process system in place at the end of 3 years. So we're beginning those conversations, have a meeting set up with Director Calvin and the homeless and unhoused offices to begin those conversations. We're having conversations with Samaritan, we're having conversations with neighborhood health so that we're looking at coordinated services and making sure that we are going upstream and not duplicating services, but expanding our resources to meet the most individuals that we can during these times.
That's fantastic. Looking forward to being a part of that conversation. Thank you.
You're welcome.
All right, next we'll go to Councilmember Benton. You're recognized.
Thank you, Chair. I just had a question, and this may be a work in progress that's not the final draft. And if this is the final draft of the plan, can we get a copy of the slides so that we can understand the flow?
Happy to make that available to you. This is the final draft.
Thank you very much.
Yeah,
As we know it, yes.
Yeah, and we've got, I was going to say, we've got that in the council office, and so that can be disseminated. Thank you. How about other questions? I think, I guess one question that I had, Dr. Ann, was kind of talking about the plan and kind of getting to the end point related to housing. I guess, is there money in the pilot if somebody goes through the process, if they can't get a voucher, but they're going to return, to being unhoused, after they go through treatment, is there money in the pilot to pay for housing? Or is that something that would be separate that you all would be figuring out based on the agencies that you're working with?
The answer is that the monies that are allocated in the project is to provide housing and to provide some assistance to individual. So the vendors that we have, both Mental Health Co-op and Samaritan, there is a piece of that budget to provide assistance to individuals, I believe we would look to them in conversations and ask that question, Councilwoman Evans, of how are we dealing with that if that's not a need that they can meet?
Thank you. And I asked that question mainly because I've been having some side conversations with Office of Homeless Services specific to vouchers and unrelated to this process entirely. But I know we're like in a little bit of a weird spot as a city with, we have more housing than we have voucher supply. And I know that's creating some challenges just in general. So just thinking ahead. But that, I think answers, I probably have other questions because I'm going to really get into, I like the charts that you included. I really appreciate that because that's a lot of detail, I think, for us to explore. And so I'll make sure that the presentation file is disseminated through the council office so everybody can take a look. Anybody else have any lingering questions before we move on to our legislation? All right. Then thank you so much for being here, Dr. Ann and Tom Sharp. I appreciate it very much.
Thanks for having us, Councilwoman Evans. I appreciate your time.
All right. We will transition into the legislative portion of our meeting. We do have a quorum with myself, council members Benton, Bradford, Huffman, Kimbrough, Nash, Porterfield, Sepulveda, and that is all of us. And so I have everything except for item number 5, which is RS 2024-568 on a consent agenda. Is there anybody that has anything that they would like to pull off of consent? Councilmember Benton, you're recognized.
Number 1.
Number 1, okay. All right, how about anyone else that has any other items that they'd like to pull off consent? Okay, then I will go ahead and start reading and then check again as soon as I get finished. So first item on a proposed consent agenda is item number 2, RS 2024-561 by Porterfield Evans and others. Approves an application for a Second Chance Act Pay for Success Program grant from the U.S. Department of Justice, acting by and through the Bureau of Justice Assistance to the Davidson County Sheriff's Office, or DCSO, to support the Sheriff's Behavioral Care Center in providing effective substance use disorder treatment and improved recovery outcomes for incarcerated adults preparing for reentry. Item number 3, RS 2024-563 by Porterfield Evans and others, approves Amendment 1 to a grant from the Tennessee Emergency Management Agency to the Office of Emergency Management to provide public assistance for damage caused by severe storms, straight-line winds, and tornadoes during the December 2021 Presidential Disaster Declaration number FEMA-4637-DR-TN. Item number 4, RS 2024-566, Porterfield Evans and others, approves or authorizes the Metropolitan government to join the state of Tennessee and other local governments in amending the Tennessee State Subdivision Opioid Abatement Agreement and approving the related settlement agreement. And then skipping over to bills on second reading to item number 6, BL 2024-429, Porterfield Evans, Welsh and Gadd approves a contract between the Metropolitan government and Concentra Health Services Incorporated for the provision of medical services to employees who have sustained occupational injuries. Does anybody have anything they need removed? Do I have a motion? Thank you. It's been moved. Do I have a second? All right, thank you. It's been moved and properly seconded. All those in favor of these items, please say aye. Anyone opposed? Anyone not voting? All right, thank you. You recommend approval. 8 in favor, 0 against, 0 not voting. Okay, let's go to item number 1, RS 2024-560, Porterfield Evans, Welsh and Swara, approves an application from the Metropolitan Government General Sessions Court for a Justice and Mental Health Collaboration Program grant from the U.S. Department of Justice to improve the General Sessions Court Competency Docket Program. Do I have a motion? It's been moved and properly seconded. Do we have discussion? Councilmember Benton, you're recognized.
Just a couple of brief things. This is basically what Judge Blackburn was talking to us about, correct?
Do you want anybody from the administration? I don't know if anybody's here from, oh yeah. Hello, Mr. Winslow. Please come forward. And I will recognize you at the podium.
I will briefly answer that question, but I'll turn it over to Sherry Lozier-Bentley, who's our coordinator for the competency program if there are any other questions.
Okay, thank
Excuse
you.
me, questions. It is the same program, but it's a different function. This grant is housing-centric, given the difficulty of securing housing, both because of cost and because of the unique composition of the clients we work with within this particular docket. Securing housing is very difficult, and this grant is based to secure that kind of housing.
Yeah,
Had
Mr.
one-
Benton.
One follow-up. I'm, in light of the July 1st, Jillian's law that's gone into effect at the state level, is there going to be any kind of a harmonization or conflict in some way? I know these are tied together with mentally ill and trying to, get them some housing or help or something.
Sherry, you can correct me if I'm wrong here, but the funds that are appropriated under Jillian's law are meant for evaluation of those who have been sent for referral to determine their competency to stand trial. No funds from that program are to be used for items like housing or care of persons.
Okay, Councilmember Benton, any other questions?
No.
Okay, how about any other questions from the committee? All right, seeing none, do I have a renewed motion? All right, it's been moved and seconded. All those in favor of this item? Anyone opposed? All right, and we recommend approval.
Thank you.
Okay, we will go lastly to item number 5, which is RS 2024-568. Porterfield Evans, Alan Swara appropriates a total of $1,971,656.19 from the Metropolitan Government Office of Homeless Services to the Salvation Army for the provision of housing services and life navigation skills to people experiencing homelessness in Nashville. Do we have a motion? It's been moved and seconded. Any discussion? All right, Councilmember Swara, I'll pick you up first.
Thank you, Chair. Thanks for recognizing me, even though I'm not on your committee. The only question that I have is that in looking at the analysis for this contract and the details of the work to be performed, it jumped out to me that it says that the program focuses on single individuals. And so my question is, if we're doing this for just the single individuals, do you have a similar program for families that are unhoused?
Yes, let me recognize Mr. Bill Clendenning in the back.
Good afternoon, and thank you, Madam Chair. And that's a very good question. And we do have other programs. We just, actually, you guys approved a program with Safe Haven Family Shelter for families. And we also working with the Family Center in a partnership. The reason for the focus is, and the COC priorities report just came out a couple of weeks ago, and it reiterated the fact that our primary focus and the primary need right now is single men. And so that's what we're trying to keep the focus on.
How about additional questions, Councilmember Swara? How about any other questions from the committee? Okay, seeing none, we renew the motion to approve. And it's been moved and seconded. Any, I don't know why I'm trying to drift backwards here. We've got a motion to approve. It's been properly seconded. All those in favor? Anyone opposed? All right, we recommend approval, 10 in favor, 0 against. Anyone not voting? Oh, Mr. Clendenning, did you have something to add?
Madam Chair, there is new leadership at the Salvation Army, and we asked him to come today. Would it be okay if he introduced himself?
Of course,
So he can start those relationships with you?
sure. Let's hear from our new leadership.
Thank you. I am Major Bill Mockabee with the Salvation Army, the new area commander here. I come with 19 years of experience of serving homelessness behind 150 years of organizational history serving the homeless. So we're excited to be here. We're excited to continue to strive to end homelessness and to be able to serve the people that our neighbors who are unsheltered at this moment. So we're excited to be here.
Thank you for being here and thank you for serving our population of folks experiencing homelessness.
Thank you.
Yes, thank you, Mr. Clendenning. All right, we're going to do a couple of quick department updates first, and I will actually go ahead and ask Mr. Danny Yates, who is here from the IAFF, because he had some information he wanted to share with the committee.
Thank you very much, Madam Chair. My name is Danny Yates. I'm a former firefighter here in Nashville and currently the president of Firefighters Local 140. First of all, thank you very much for the opportunity to speak, and thank you very much for your part in securing a 4% COLA for all Metro employees. I'm here today about safety and well-being of all Local 140 members. The Nashville Fire Department personnel that respond to emergencies every day need your help in protecting their personal safety and personal property. Over the course of more than a year, the personal vehicles of fire and EMS responders have been vandalized and or stolen from at least 15 of Nashville's 40 fire stations, including fire headquarters. In June of 2023, I met with Chief Swan's command staff and asked for assistance in addressing the issue. That same month, I asked the president of Fraternal Order Police for assistance, and we received a few portable surveillance cameras that were set up on just a few locations on our fire stations. In March of this year, I talked with personnel from the Safety Division, and we both concluded right away this is an issue that's beyond our control. It's bigger than what we can do. Last week, on June 30th, 5 personal vehicles at Station 6 in Antioch and 6 personal vehicles at Station 9 in Inglewood were vandalized, and 1 of them was stolen. The criminal activity has doubled over the past year, and the sense of feeling unsafe and unprotected while at work is on the rise among our employees. I know this is a very difficult issue to address, and there's no clear-cut answer on how to control it. I also know that each one of you care deeply about the well-being of all Metro employees. I'm respectfully asking on their behalf that as an elected body, you review this situation and offer ideas that produce an action plan that includes ways to control this criminal behavior that's affecting all of the hardworking Metro employees. Thank you very much.
Thank you, Mr. Yates, for bringing this to our attention. Mr. Young, did you have anything you wanted to say related to Mr. Yates's comments, or just about another topic entirely?
Yeah, I can speak a little bit on this. I know Chief Swan had sent an email out to all the employees of the department about they're aware of this, and they are seeking, like President Yates mentioned, this is difficult to tackle, but they are aware of it, and they are trying to make some kind of plan, maybe some security fencing around some stations. So it is a problem, and it is being addressed.
Okay, and so as far as a plan is concerned, I mean, is there an estimated time potentially when that will be shared, I guess, with the employees across all the fire halls?
Yeah, I'm sure it is. This Monday's, yesterday's staff meeting, it was briefly talked about there, and that's when the email came out on yesterday. So there is, it's a conversation with PD, it's a conversation with General Services. I mean, there's a lot of people in the conversation now. But I will get, Chair Lady, I'll get with Chief Swan to get a timeline on this. But this has been going on for some time.
Okay, thank you I'm interested in the timeline that we can share with the committee, and, kind of just thinking about like visits to like our police precincts. Like I know they have fencing, around their employees' vehicles. And so I hope we can figure something out for your team. So that way they're not having to navigate, handling fire situations, and then also thinking about, is my car going to be there when I get out?
Right. And there is some stations, that has some fencing, and they've got through the fence too. So
yeah. I know fencing is definitely not a perfect solution. Looks like Councilmember Bradford has a question, so I'll recognize him.
Thank you, Chair. Since this is involving Metro employees and I'm chair of government operations, which includes our Metro employees, any information that comes to you, could you send it to me or could it be distributed to the government ops committee as well?
Of course. Thank you for asking that question. Thank you, Mr. Young. I do have another question for you, though. Don't walk away, please. So I want to talk about heat a little bit because I had sent an email. I had reached out based on some of the communication related to like the, the heat and temperatures, because I think there was some communication from the mayor about like if cooling stations open X, Y, and Z, but it doesn't give us a lot of detail around, what that, if it reaches 110 degrees, the heat index, like how long does it have to last before, we would potentially have a cooling station? Because I know, we're just about to hit like the hottest months in July and August.
Yeah,
And if you don't have that information, I'd be happy to get it from you later. And
I did email that to you.
Okay.
Check and make sure you got that. Joseph Pleasant sent me the policy,
Okay.
and I forwarded it. It was actually yesterday.
Okay, cool. I'll look for that. And,
Yeah.
and I will, if I don't find it, I'll circle back. But otherwise, if I find it, I will go ahead and send it to Margaret for her to disseminate to the council, because I think that's a question that we'll all probably get.
Okay.
And especially like as you tie it back to the state, with their reference to like cooling centers, and they have some things listed like go to the mall and stuff like that.
Right.
And the reality is, that's not really feasible. And so I think, for a lot of people, so we just have to think through, I think, like, what does that look like? And I know that, Office of Homeless Services, they have kind of a cold or a warm weather kind of action plan that they execute on. And so any communication that we can share, because I don't know about anybody else in this room, but summer is the worst for housing, apartment complexes, where air conditioners go out and then all of a sudden it's 100 degrees in someone's apartment and they can't get their landlords to respond. And so I'm going to recognize Councilmember Sepulveda.
Thank you, Chair. Piggybacking on that, I would want to know if you all had any data as far as construction sites. The state of Tennessee prohibits mandatory heat breaks. Wanting to know if you all had data as far as how many emergency responses you all have done to construction sites. And I think it would be great to know as far as complexes as well when ACs go out.
Yeah, and I can get that for you from our IT department. I'm not sure if our run ticket would label it was a construction site, but it would be an address. And I'm not sure how accurate it would be, just because it would be an address and not necessarily say construction site.
Yeah. Well, that's probably, it'll be good to know what we do have in place right now as far as identifying, since we have funded and we should be passing hopefully tonight the construction and compliance board and legislation, then we should figure out a way how to track that.
Yeah, thank you very much for asking that question. Any other questions for Mr. Young? Oh, Councilmember Nash, you're recognized.
Thank you, Madam Chairman. I thought everybody loved the police, or they loved the fire department. So I'm not just sad to hear we're in that kind of issue. Have we had, what is the most common form of theft?
Well, I'm sure just looking for valuables inside a vehicle.
I meant
busted windows.
vehicle thefts. Are we leaving keys in the car, or do we know?
No, they're busting the windows and just going through looking for anything valuable.
Yeah, I was questioning, there were car thefts. The cars are gone.
Oh, unless Brother Yates has some information, only one that I know of.
Mr. Yates, or President Yates.
I don't have a specific number on the number of cars, but there have been several cars stolen, and the latest one was last week. I don't know the brand or make or anything, but it's just random.
Okay.
And they are just breaking windows, tearing up property. Sometimes there's nothing in the vehicle. They're just tearing it up to see what's in it. And this is happening all over the city, not just in different areas. Of the 15 that I mentioned, they're everywhere. There's no pattern as far as one side of town or another, everywhere from Bellevue to Inglewood to all points in between. And it happens at different times of the day and night. A lot of times if the people are out of the stations, it happened at Station 8 in the middle of the day while they were there. So some of the parking lots are semi-removed from the station, and you can't hear what's going on, especially at night. We make enough calls. Now our call volume is very high, and people are in and out all the time. So the opportunity is there, and the criminals are taking advantage of some of the opportunities that's presented. But it's the situation is presenting itself where I'm afraid our own people are being involved in some of this, and now we've got a whole different issue of trying to protect their property, and if they just walk into a situation unknowingly or come back from a call and pull up and vandalism is going on, then I don't know what they'll do or what they won't do. But that's what we're trying to avoid here, and that it is very difficult to do, but we do need some help in that area from all different directions.
Yeah.
I noticed you said you had two surveillance cameras brought in, the portable. Do these stations themselves not have some sort of surveillance motion detection system? They're fairly cheap anymore. That's probably something that we need to be looking at.
I think it's something you should take a look at doing, outside perimeter cameras, just I don't know where they would go as far as the IT and that sort of thing, or what kind of tape system it would be, but at least have something, some type of surveillance that we could see what's going on so the police can get involved and find the criminal.
I know you should all have some modems because you got TVs. And there's, hopefully we can get you working. Super.
Yeah, thank you.
Sorry this is happening.
Councilmember Porterfield, you're recognized.
Thank you, Madam Chair. I have a question about the cameras. Would a fence not work better than the cameras? It seems like they said the police has fences around their parking. So are police having similar break-ins? And if not, would the fences suffice instead of the cameras? That seems like maybe a cheaper solution than cameras.
Council Lady, fencing don't seem to stop. There is some stations that does have fencing parking lots, and they're getting in there too.
Thank you. Are the surrounding businesses around the fire stations also getting hit, or is it that fire stations are getting targeted?
I'm not sure about anything surrounding the station. I don't know.
Okay, thank you. If we can get that information, maybe from MMPD, if they can check the data for the area, that would be helpful. Thank you.
All right, thank you for that question. Any other questions? All right, well, I appreciate everybody's time. Thank you all for being here, and we're meeting adjourned.